Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the flexor retinaculum, and also I will give outline the carpal tunnel syndrome. Okay, so we'll go through the anatomy of the flexor retinaculum. Flexor retinaculum. Okay. So what is flexor retinaculum? The flexor retinaculum is the thickening of the deep fascia, that is the antebrachial fascia or the deep fascia of the forearm in front of the carpal bone. Okay. The flexor retinaculum is the thickening of the deep fascia of the forearm, deep fascia of the forearm in front of the carpal bones, in front of the carpal bones. So this is the thickening of the deep fascia or antebrachial fascia in front of the carpal bones. What are the carpal bones? We have 8 carpal bones. We have 8 carpal bones. Okay. 8 carpal bones. These are the scaphoid, lunate, triquetral. Okay. Scaphoid, lunate, triquetral, pigiform, then the trapezium, trapezoid, okay, then capitate, hamate. Okay, we have 8 bones. Okay, these are the carpal bones. They are important at the wrist joint area here, carpal bones here. Okay, we have the flexor retinaculum. So what happens? We have carpal bones. They made concavity by the carpal bones on the ventral aspect, the lower end of the forearm. Okay, at the junction between the forearm and the hand. So we have carpal bones forming an arch. Then arch is breached by the flexor retinaculum. So this is the flexor retinaculum. Flexor retinaculum. Okay, so this is the tunnel, we call it carpal tunnel. This is the carpal tunnel. These are the bones, the carpal bones here. We have carpal bones in 2 rows. In each row we have 4 carpal bones. Okay, so we got the flexor retinaculum, attachment of the flexor retinaculum medially, pigiform bone and the hook of the hamate. If this is medial, if this is lateral, we have attachment is attachment medially to the pisiform bone, the attachment of the flexor retinaculum. Okay, attachment of flexor retinaculum medially attached to the pisiform bone. Pisiform bone, this is one of the carpal bone, and hook of the hamate bone. Hook of the hamate bone. Okay, medially. You get medial attachment, pisiform and hook of the hamate. Okay. Laterally, it is attached to the tubercle of the scaphoid bone and crest of the trapezium. Laterally, it is attached to the tubercle of the scaphoid, tubercle of the scaphoid bone, scaphoid, and to the crest of the trapezium, and to the crest of the trapezium. Trapezium. Okay, so to the crest of the trapezium. We got the lateral attachment here. We go there, the scaphoid and the crest of the trapezium. We got that. Okay. We have two slip here also. Here medially we have one slip that covers the ulnar nerve and the ulnar vessels, and we have laterally we have another deep slip for the passage of the flexor carpi radialis. So medially we have one slip. Okay, this is also called volar carpal ligament. Okay, so that is associated with the pisiform bone for the passage of the ulnar nerve and vessels. Lateral slip, that is deeply located, and it is slip to the medial lip of the group of trapezium. So that is make another passage for the tendon of the flexor carpi radialis. So we get here the flexor carpi radialis. Flexor carpi radialis. Here we get the ulnar nerve and vessel. Okay, ulnar nerve and vessels. Okay, and this is certainly the carpal tunnel that include the flexor carpi radialis tendon. Okay, carpal tunnel, but the ulnar nerve and vessels are not included as a content of carpal tunnel. Okay, so to remember that, we got the carpal tunnel. Then we'll go, some structure passes over the flexor retinaculum, some structure passes through the flexor, some structure passes through the carpal tunnel. What structure passing superficial to the flexor retinaculum? You have to know that part. Structure passing superficial to the flexor retinaculum. Okay. Structures passing superficial to the flexor retinaculum passing superficial to the flexor retinaculum. What are those structures? Okay, these are the palmaris longus tendon. Palmaris longus tendon partly insert into the flexor retinaculum, then continued to the palmar aponeurosis. Palmaris longus tendon. Okay, this is one. Then palmar cutaneous branch of the median nerve and ulnar nerve. Okay, cutaneous branches of the median nerve of the median nerve and ulnar nerve. Okay, we got palmaris longus tendon, the palmar cutaneous branch of the median nerve and ulnar vessels and ulnar nerve. Ulnar vessels, that means artery and vein, and ulnar nerve. So remember, palmar cutaneous branch of the median nerve and palmar cutaneous branch of the ulnar nerve passes over the flexor retinaculum. So again, summarize what are the structure. Those passing over the flexor retinaculum, these are the tendon of the palmaris longus, palmar cutaneous branch of the median nerve, palmar cutaneous branch of the ulnar nerve, ulnar artery, ulnar vein. We got that. Okay. So those going above, suppose here is the ulnar artery, ulnar nerve, that is above the flexor retinaculum. Flexor retinaculum connects this bone to that bone. Okay. So we got that. So here flexor carpi radialis tendon, it is getting another passage by deep sleep from the flexor retinaculum, also called transverse carpal ligament. Okay, that is included as a part of the carpal tunnel. Okay, so flexor carpi radialis tendon is a content of the carpal tunnel. Okay, but the ulnar nerve, ulnar artery are not. Palmaris longus tendon are not the content inside the carpal tunnel. We got that. Okay. Now structure passing through the carpal tunnel or passing underneath the flexor retinaculum, structure passing underneath the flexor retinaculum, underneath the flexor retinaculum, or we can say structure passing through the carpal tunnel, or structures passing through the carpal tunnel. Okay, so what are those structures? We have tendons. What are those tendons? We have tendons. What are those tendons? These are the 4 tendons of flexor digitorum superficialis, flexor digitorum superficialis, we have 4 tendons of flexor digitorum profundus. Okay, we have tendon of flexor pollicis longus, flexor pollicis longus. We have also include the tendon of flexor carpi radialis, although it has a separate passage within the carpal tunnel, tendon of flexor carpi radialis, tendon of flexor carpi radialis, Okay, so these are the content, but most important content is the ulnar nerve. Okay, ulnar, or most important content is the median nerve, not ulnar nerve, median nerve. Ulnar nerve is not a content of the carpal tunnel. Ulnar nerve passes over the flexor retinaculum. So most important content is the median nerve. Then 4 tendons. So this is the median nerve. Tendons of the flexor digitorum superficialis, tendon of the flexor digitorum profundus, tendon of the flexor pollicis longus. Then we also include tendon of the flexor carpi radialis. So let us summarize. What are the structures passing underneath the flexor retinaculum? Or what are the structure those are present or goes through the carpal tunnel? We have the most important structure is what? There is the median nerve. Then 4 tendons of flexor digitorum superficialis, 4 tendons of flexor digitorum profundus, and 1 tendon of flexor pollicis longus, and we'll also include the tendon of flexor carpi radialis. So we got the contents of the carpal tunnel. Okay. So what is carpal tunnel syndrome? Carpal tunnel syndrome is any condition that compresses the median nerve in the carpal tunnel. So if we have tendinous inflammation, we also add, as a content, we'll add two more things. One is the radial bursa. Another one is the ulnar bursa. Okay. Those are also contents. So again, we'll finalize the content. Number 1, median nerve, 4 tendons of the flexor digitorum superficialis, 4 tendons of the flexor digitorum profundus, 1 tendon of the flexor pollicis longus, and 1 tendon of flexor carpi radialis, radial bursa, ulnar bursa. So we got the median nerve, flexor digitorum superficialis, flexor digitorum profundus, flexor pollicis longus, tendon of flexor carpi radialis, radial bursa, ulnar bursa. These are the content of the carpal tunnel. Okay. So any pathology, any of this structure may compromise the median nerve, and we will get the carpal tunnel syndrome. Okay. So what are the causes of carpal tunnel syndrome? Okay. Causes of carpal tunnel syndrome, or etiology, etiology, or you can call causes of carpal tunnel syndrome. We may not know the exact cause of carpal tunnel syndrome. We may not have any obvious cause. We call it idiopathic. It may be due to hypothyroidism. Okay. It may be due to pregnancy. Not necessarily all pregnancy, but someone in the third trimester pregnancy may have carpal tunnel syndrome due to some occupation, like in construction work or typing, okay, typing or any construction work, okay, occupation. So we got that. It may be due to protrusion of the ganglion or synovial sheath, ganglion, that is synovial sheath around the tendon, synovial sheath around the tendon, not the collection of neurons, around the tendons is called ganglion. Okay, this is different from the collection of neurons. Ganglion protrusion. There may be trauma due to any region. It may be traumatic. Okay. It may be a part of arthritis, like rheumatoid arthritis. Okay. So there are many causes of carpal tunnel syndrome that may compromise our tunnel. That tunnel contains the median nerve, many tendons. Okay. Ulnar bursa, radial bursa, flexor digitorum superficialis, flexor digitorum profundus, flexor pollicis longus, flexor carpi radialis tendon. Okay, so that may compromise the median nerve. Okay, so we may get the carpal tunnel syndrome. These are the causes. So what will happen in carpal tunnel syndrome? Median nerve is very important nerve. Median nerve innervates many muscles. Median nerve in the hand, in the hand. Okay, what muscles are innervated by the median nerve? It innervates the abductor, pollicis brevis, okay, opponens pollicis, okay. It also innervates the flexor pollicis brevis. It innervates the lateral two lumbricals. Okay. So these muscles are present. Specifically, these three muscles are the thinner muscles. Thinner muscles. So if they don't get the nerve supply, then there will be flattening of the thinner eminence. We call it ape-like. Due to atrophy, no nerve supply, there will be atrophy. That will lead to ape-like hand. Ape-like hand. That means depression of the thinner eminence. Okay. Two lumbrical is also essential for the fine movement. So fine movement will be disturbed, gripping will be weak. Okay, so you got that. And opponent's policy is essential for opposition function, so that will not work. So movement of the fingers will be in jeopardy, specifically the first, second, third, and part of the fourth finger. So 3.5, 1, thumb is 1, index is second, middle finger is third, ring finger half. So this part movement will be in jeopardy, okay, because muscles are not working here, okay. So we'll have problem. We know that these muscles, flexor digitorum superficial, is innervated by the median nerve. It gets nerve supply not at the wrist joint, at the above. Flexor digitorum profundus, part of it is innervated by the median nerve, the lateral part. Middle part is innervated by the ulnar nerve, but those are getting innervation at the forearm or below the elbow, so that will not be in problem, but the thinner muscle and two lumbricals will not work. Okay, we got that. But the cutaneous innervation in the middle of the palm will be okay, because there is a cutaneous nerve from the median nerve that passes over the flexor retinaculum. So this part, cutaneous sensation will be okay, but cutaneous sensation of the thumb, index finger, middle finger, half of the ring finger will be lost. There will be paresthesia, okay, 3.5 finger. Just central part of the palm, sensation will be okay. We got that. The features of carpal tunnel syndrome. Okay, we got the causes of carpal tunnel syndrome. How can we test carpal tunnel syndrome? We have two tests. One is called Tinel sign and another is called Phalen's test. Okay. Okay. Tests for the carpal tunnel syndrome. Carpal tunnel syndrome. We have two tests. Okay. These are physical tests. Okay. Physical test. Okay. So one is the Tinel sign. Okay, very easy to do. Just tapping on the middle of the wrist here on the frontal aspect, just over the flexor retinaculum. Tapping will cause tingling, numbness of 3.5 finger. Okay. Another test is called Phalen's sign. Or Phalen's test. Okay. This is done by placing the hand together like this for around 1 minute. Okay. Then we'll get tingling, numbness, and altered sensation from the patient. Okay. These are the tests. We do that. We can, for investigation, we can do the image study, X-ray, MRI, nerve conduction velocity test is also essential sometimes to diagnose accurately. Management of carpal tunnel syndrome. Management of carpal tunnel syndrome. Okay. So, to find out the cause, we'll remove the cause. Okay. Suppose a pregnant lady will deliver a baby, then there will be no carpal tunnel syndrome, most likely not. Person using too much hand, they may change occupation if possible. Okay. So, treatment of cause. Okay. So, treatment or cause. NSAID. Okay. Non-steroidal anti-inflammatory drug like ibuprofen. Some physician can give steroid orally, okay, or some type of injection locally, okay, analgesic injection. Okay, so if the person has hypothyroidism, we can provide that person with thyroxine. If she is pregnant, we can wait for the delivery of the baby. If she has arthritis, she will get non-steroidal anti-inflammatory drug like that. If these all fail, then surgical treatment. Surgical treatment. Okay. And that's all about the anatomy of the flexor retinaculum and carpal tunnel syndrome. So if you like my video, please subscribe my channel, support my channel, hit the button. Please share the information with your friend. If you have any question, please feel free to ask me. Have a nice day. Bye now. Thank you.